For the manual muscle test for Anconeus, this is going to be a little bit of a tricky one, and it really is helping lock the elbow with that terminal extension. So I have her in a slightly flexed position, and I'm just going to ask her to lock her elbow and hold it in that position. So if you again go from a slightly bent, go ahead and lock the elbow. So that is its active range of motion. For the break test, we do not want it to be in a locked position to start, so we just unlock it about there. So just a tiny bit of flexion, and I'm again going to ask her to hold that position as I pull against it. You can easily see it sticking up right now as it's working. 3, 2, and 1. So again, a 5-second isometric contraction. I'm going to give her a little bit of a bend, and for the concentric, she's going to win. So go ahead and push, push, push until that elbow becomes locked again. And there we go. So there's the concentric. Now, because of this muscle really only doing that last few degrees of extension, any amount of flexion, taking it kind of to this fully flexed position is going to lengthen it, even though you're really going to end up hitting soft tissue approximation and not getting a real tissue stretch often for Anconeus. But that would be its length position.